Ladies and gentlemen, thank you for standing by and welcome to the Medicaid Redesign Team 2 Meeting Number 3 conference call. At this time, all participants are in a listen-only mode. Please be advised today's conference is being recorded. If you require any further assistance, please press star 0. I would now like to hand the conference over to your first speaker for today, Mr. Michael Dowling. Thank you, sir. Please go ahead.
Oh, thank you so much, and welcome everybody. Welcome to members of the committee. Thank you again for your commitment and your continuous input. I also want to say welcome to all of the members of the public that are listening in. We've had lots of discussions on the recommendations, and I want to say to the members a special thanks for the perspective you've given and for the input. I believe that there is concurrence that we are directionally correct in the recommendations, and while all may have some element that they don't like, some small element they don't like, I want to impress on the committee the importance of the overall package. And because this is part of a process, and we are giving recommendations to the governor, and there will be many opportunities as time goes on for further discussion on many of these items that we will be voting on. Some are short-term, some are long-term, implementation issues, other issues like that will require continuous input, and we look for people's input as that process goes forward. So let me indicate that what we're going to do now is I'm going to ask Rob Mojica to give a little bit of context. Then I'll ask Paul to give a brief overview. Then we're going to take comments from members of the committee that want to make comments. And then I will call for a vote on the whole package, not by individual entity, but by the whole package. And I'm hoping that we can conclude this very, very satisfactorily. So with that, let me ask Dennis Rivera if you want to make a comment as the co-chair.
I think that you have very ably represented my thinking and my feelings, and I think we should commence.
Thank you, Dennis. So Rob, let me turn it to you. Thank you.
Okay. Thank you, Dennis, and thank you, Michael. And thank you to all the members of the MRT. Today we're doing this by conference call because of the healthcare emergency that we're in. So we are not doing this and continuing with the MRT without acknowledging where we are in both the state and the nation and the world. We're not doing this in a vacuum. We started the MRT as a way to fix the Medicaid program so that it would be funded going forward for the next few years like we did for the first MRT. It was growing faster than we could afford, and the task was to right-size the program so that it was available and being able to be managed for those who need it the most and fix some things in the system that needed to be fixed. We're now in a different time. The different time that we're in actually makes the work of the MRT even that more important. This week, the comptroller said that the state's revenue forecast would be off by up to $7 billion. Based on the trajectory of where things are now, that number would be on the lower end of what we're looking at. The state has to pass a balanced budget constitutionally. Can't waive that requirement. The federal government, unlike the state government, right, has the ability to print money. They have the ability to just run a deficit. They have the ability to provide stimulus that the state doesn't have. We brought this group together because you all have the expertise to inform the decisions on how you manage the program going forward. As we move forward, we're going to have to make some tough budget choices, not in relation to healthcare, but in relation to the entire state budget. And every state is going to have to be doing this. The recommendations that are here help to inform so that when we move forward, we make smart decisions that are informed by all of your expertise in the absence of this process. Some have talked about why are we doing it at all. In the absence of this process, we'd be making tough decisions without your informed advice and your recommendations. So it's more critical now than ever that we understand what could we do to use the healthcare dollars better as we move forward. There's the federal government. Some members have raised, others have raised. The federal government has talked about or passed the House has, but they're going to pass the first relief bill, which includes an increase in FMAP. We're going to use a portion of those FMAP dollars to otherwise change or delay or round out the edges of some of the recommendations here, because some of them are not, you wouldn't want to implement them now. You may have to make other investments in some areas now, depending on how this crisis goes, for sure. We're directing money right now to providers who are working on the front lines of the crisis. But we're going to use the FMAP dollars to soften the edges of these recommendations, delay the recommendations. But when we get to the other side of this, right, we want a Medicaid program that actually works. And these recommendations help to inform how we move forward with the Medicaid program beyond, the one-time revenues that we may be getting from the federal government. We brought a diverse group of people together to serve on the MRT, which means that they have different perspectives and also different ideas and opinions on the best way to achieve the goal. Some of those opinions, you may like some recommendations, you may like others. In total, on balance, the package works, and this is not, you're not voting on the budget here, you're voting on the recommendations that will then go to the governor and go to the legislature, and they're going to have to be modified to a certain degree. And now we're going to use the FMAP dollars to overlay them, so there is time that we can set aside as we move forward with the crisis, and then revisit this and the budget together. So this is just one part of that process. We have legislative representation on the MRT. We've been talking about this crisis and the budget going forward and what we'll do. And rest assured that we're going to be responsible, and we're going to deal with what is a healthcare crisis by making sure that the funds are available to healthcare in this crisis. So I want to thank everyone for the time you've spent, for the expertise here. Some of you are working on the front lines now and taking the time to do this. I'm sure that we're going to be reaching out to all of you, as we move forward in the coming, what's hopefully, weeks, not months, but your continued support even after today is going to be critical. You're all selected because of who you are and your expertise, and we're going to be relying on you going forward in what is an unprecedented time for the state and for the nation. So I want to thank you, but I also want you to understand that we're not taking this lightly, but this is actually more important now than it was when we started, and the decisions here are really going to inform how we move forward with the legislature. So with that, I'll pass it back to the chairs, Michael and Dennis.
Thank you, Rob, and on behalf of everybody, I want to thank you for your support and help here, and obviously for the extremely difficult job you have ahead of you and currently doing. So congratulations, and also for providing very, very, very relevant context to all of this. Paul?
To briefly thank all the members for a tremendous amount of work. It resulted in these proposals that are summarized in the executive summary that's on the DOH website, on MRT, under the project updates for meeting number 3. And with that, I'd like to turn it over to Donna Frescatore, who will walk through an overview of the specific proposals.
Thank you, Paul, and thank you, Michael and Robert. Good morning, good afternoon, everyone. As Paul said, we posted this morning to the MRT2 website 2 documents. If you have access to that now or later, you'll see that along the left side of the website, under meeting number 3, there are 2 documents. The first is an executive summary of proposals, and the second is an executive summary card. I won't today speak of all the details contained in each of the proposals, but I'll give you the highlights of them, nor will I talk about the fiscal implications of each of the proposals, but you will see them on the second document that is on the website. So, as we know, as part of the state fiscal year 21 executive budget, Governor Cuomo called for the reconvening of the Medicaid Redesign team to be modeled after the very successful MRT took place several years ago. In the months that have followed, as Robert said, much has changed. But this process, from our view in the Medicaid program, is even more important today than it was when we began. As we talked about when we last met, in the months since we began, we have at the department received thousands of ideas through both public forums that we held throughout the state and through a public website where individuals and organizations could submit their proposal through our website. The primary goals of the MRT have really been twofold, as Robert said. First, to restore financial sustainability by implementing shorter-term actionable reforms, and to take longer steps towards structural reform that ensures that the Medicaid program is there for the millions of New Yorkers that rely on it. The package of proposals and recommendations that are before the MRT2 panel today reflect the recommendations that were submitted by stakeholders, synthesized into a comprehensive policy agenda for Medicaid, organized roughly by healthcare sector. Taken collectively, we believe that these recommendations achieve the goals of the MRT, both the short-term goals and the longer-term reform goals. When approved by the MRT2, the proposals will be advanced by the executive through the budget process, with the executive having the discretion regarding effective dates, and of course considering these recommendations in light of the healthcare and economic disruption that has been caused by COVID-19. So with that, I hope you have found, if you wanted to follow along, the materials on the website, and let me just briefly describe those proposals by sector. So first, we received many recommendations regarding the Medicaid global cap, and the recommendations contained in the document recommend redefining the spending cap in terms of the base on which the spending base on which the cap is based, as well as the allowable growth factors. Recommendations related to the hospital sector directionally seek to strengthen the safety net hospitals, that is, those hospitals that serve a large number of Medicaid patients, by largely changing the way indigent care funding is distributed. The recommendations that you will see largely incorporate much of the discussion of the Indigent Care Work Group, including removal of the transition collar, and seek to mitigate the risk of federal dish cuts. The care management proposals include a series of refinements, most specifically to health homes, which have proven successful, but we've certainly learned over the years on refinements to be made to those proposals, and with a focus on people with behavioral health needs. The series also includes a focus on patients with chronic diseases such as diabetes, behavioral health, sickle cell anemia, and on maternal mortality and opioid use. Proposals also focus on children's health care needs, including children with behavioral health issues and children who are medically fragile, making a series of investments and initiatives that will improve health outcomes and in turn reduce Medicaid spending costs in the future. Over 4 million of 6 million New Yorkers enrolled in the Medicaid program receive their services through a managed care plan. The recommendations before you today strengthen the collaboration between those plans, providers of health care, and care management systems to achieve the goal of improving quality and cost efficiency. The recommendations importantly stay the course on value-based purchasing and in fact strengthen it by bringing additional partners such as behavioral health providers and health homes into value-based payment arrangements and community-based organizations as well. They also include recommendations to streamline administrative action, modernize the way electronic submission of information, and to ensure the fiscal accountability and efficiency of the program. A number of the recommendations that you'll see detailed in the executive summary are advanced through the Long-Term Care Advisory Group established as part of MRT2 and relate to managed care, the fastest growing component of Medicaid spending. The recommendations seek to preserve care for individuals based on medical need, implement rational administrative efficiencies in both the personal care program and the consumer-directed program while maintaining the state's commitment to self-direction. They advance the goal of enrolling persons duly eligible for Medicare and Medicaid in integrated products, and they make recommendations to modify eligibility rules to ensure that Medicaid resources are there for persons who need them. The recommendations also include a series of actions related to the Medicaid pharmacy benefit. These actions seek to achieve full transparency in the way Medicaid purchases prescription drugs by combining the state Medicaid program's purchasing power across all payers in the program, leveraging additional manufacturers' rebates and preferential pricing. The recommendations intend to ensure that there's visibility into the prices Medicaid pays for drugs, regardless of whether or not the Medicaid fee-for-service or managed care program is making that payment, and the ability of Medicaid to negotiate rebates with drug manufacturers. You'll see that the recommendation includes in the first year a planning process that would ensure a smooth transition for consumers, ensure access to medications, and ensure that the health plans, who are partners in caring for Medicaid patients, have the data they need to ensure patient compliance and oversee the quality of care their members receive. A series of proposals and recommendations related to transportation services, which in the first meeting we showed some data on the escalation in costs for those services, seek to ensure that Medicaid patients have reliable and safe transportation to medical care using the most appropriate mode of transportation and at prices that are fair and reasonable. Reforms include transitioning to a single statewide transportation broker through the establishment of a transportation provider network under a risk arrangement. The recommendations also propose that we modernize systems to be able to take advantage of new partnerships with the MTA and other public transit providers to ensure efficient transportation services when appropriate for the patient. Finally, the transportation Recommendations include, with tremendous public support, a program that would provide greater flexibility to ambulance care teams to address emergency health care needs of Medicaid beneficiaries following a call to 911.
Okay.
With that, Paul, I'll turn it over to
Okay,
you.
thank you very much. And as you'll see in the executive summary, it also calls for enhancements in health IT and targeted investments in social determinants of health. And as Rob said and Donna said, these proposals will be advanced to the governor to be considered in the development of the final budget proposals. With that, Michael, turn it back to you.
Yeah, and we said at other meetings, we're not making budget here. We're submitting a series of recommendations as an advisory to the governor. So with that, thank you, Paul. Thanks, Donna. Let me open it up for comments from members of the committee. Who wants to go first?
This is Lorraine Brown.
Thanks, Lorraine.
Thank you, Michael. As you said, we're voting on the whole package, and I will just briefly state that I believe that the work done to eliminate the transition callers, particularly to improve the indigent care pool and its distribution of dollars going to those providers who need it most, is a good first start. And as you and others have said, this is the beginning of a process. So I would say that it's a positive first move to ensure that not only is the state protected from dish cuts, but also and directing funds to those providers who are serving communities that have a preponderance of government-insured patients. I would also say that many of the recommendations are very much focused on refining programs to ensure that the people who most need those services continue to get those services. And I would urge that, again, this first start in the process, as the process evolves and in the process of getting really to how things get implemented, keeps that in mind, that are always at the forefront of those who need to implement these recommendations. It should be to ensure that the most vulnerable and those who need the services the most be considered in terms of protecting their access to critical services supported by Medicaid.
Thank you, Lorraine. Thank you. Anybody else?
Michael,
Hi.
Steve Corwin. Sorry
Steve.
that I joined a little bit late.
No problem.
I want to express my full support for this package. I think it's been done in an extremely thoughtful manner. Echoing what Lorraine said, I think that we have taken great pains to make sure that our most vulnerable populations are being well cared for, and that we also have a path to improve their care. These are never easy decisions to make, but I think that the job that Donna, Paul, the entire team did really extraordinary, and I'm happy to see that a lot of the public's comments were brought into this, so I am fully supportive of this package.
Yes, this is T.K. Small. I'd like to first thank the two co-chairs of the committee, Dennis Rivera and Michael Dowling. I very much appreciate this entire process, and in many ways, this has been one of the highlights of my entire 27-year career as a disability rights attorney. When I was growing up, I lived for 9.5 years in a rehab hospital. So when I decided to become an attorney and help people with disabilities live to their maximum independence and freedom in the community, I take these issues incredibly seriously, and this is an opportunity for me to help in the overall process of making the Medicaid system in New York a stronger system. So there are many parts of the recommendations that I do like, but I have some reservations, and I think this is an incredibly important conversation that needs to continue well beyond the vote today, and it should be more of an ongoing process where we continually work with stakeholders to hear how Medicaid serves to help people live integrated lives in the community. And I look forward to possibly being part of that conversation going forward.
This is Pat Wong. I also want to thank you for the opportunity to participate in this incredibly important set of activities. It's a very challenging time. It was a very challenging, time-constrained set of deliverables that we had to achieve, but I am very pleased to have been able to participate.
Michael got kicked off the call, so he's dialing back in, but if there's a lull, you'll have to move it along.
Okay.
Okay.
Sure. Do you want me to? We should wait.
This is Dennis Whalen. Just got a call from Michael that he got kicked off the call. He's trying to dial back in immediately, but I think folks that have comments should still proceed.
Okay. Let me just proceed then. In the interest of time, it's Pat.
And this is Dennis. I tried to do the impossible, which is to chair the meeting in Michael's absence. But that's what I
I think you can do it, Dennis. Just echoing what TK just said and others and Mr. Mujica in terms of the quality of people who served on the team, I really commend them. And going forward, I'm sure that we will all be at the ready to do anything that we can to help sustain the program in a way that achieves access and quality and in a way that the state can actually afford, especially in this troubled time. I just wanted to highlight two very complex areas of recommendations in the proposals, one having to do with the carve-out of pharmacy from Medicaid managed care, which Donna mentioned, 4.5 million people are in that program. And the second is a group of statutory reforms in the managed care section intended to reduce inappropriate payment denials to hospitals. These are very complex areas. The second one in particular involves stakeholders outside of the Medicaid table, involves employers who purchase commercial insurance, et cetera, et cetera. And for both, I would just urge that the state focus in and, immediately convene stakeholder groups or go through a process to make sure that the goals are achieved without unintended consequences for example, the cost of pharmacy, consumer, Medicaid clients, care on the one hand, transparency and working with the industry on that, I think would be very welcomed. And on the second, the payment reforms to ensure that there is a balanced package that protects hospitals, achieves the goal of reducing inappropriate payment denials, but again, does not have unintended consequences on people who pay for health insurance. Thank you.
Thank you, Pat. Anybody else who wants
This is Christophe Vecchio. I'm with MVP Healthcare, and I also would like to thank everyone for the opportunity to be involved with this group. I am a pharmacist, and like TK, never imagined that I would be, with a group of people as talented that I was afforded the opportunity to work with. I'm going to vote yes today because I really feel assured by the process that will further analyze the recommendations. And like Pat said, especially around the statutory reforms related to payment, I think there's consequences outside the Medicaid space that we have to think about, and as well as the pharmacy carve-out. I think these will have, because they're so large and looming, they will have the stabilizing and lasting impact on the program if we do them right. So I look forward to continuing the conversation in those areas and any other areas that I'm asked to participate in. Thank you.
Thank you so much. Michael, are you back? Okay. Anybody else who wants to speak?
Yes, this is Tom. Oh, go ahead.
Hi, Dennis. This is Emma DeVito, and I also just want to join my colleagues. This was such an effort from everyone, and I have tremendous respect for everyone that participated. Also, my hat goes off to the staff, Donna, Paul, and the folks at the state for their willingness to listen to us and really entertain a really open and honest discussion. For me, I think this was an opportunity to ensure that this program, the Medicaid program, continues to survive, the viability of this program that is so important to so many people that need the service. And in particular, the focus that I had participating in the advisory long-term care group, that the managed long-term care program, which serves so many individuals that need the service, continues to be viable and continue to provide the services for many people that need it. So I think it was a good process, and I hope that we can continue the dialogue going forward. And I thank everyone for allowing me to participate. Thank you.
Thank you so much.
Anybody else?
Yes, this is Tom Quattrochi from Erie County Medical Center in Buffalo. First of all, thank you, Michael and Dennis, for your leadership, and I'd like to commend all the commissioners on the committee for their work, and the governor's staff, who just did an unbelievable amount of work in a short period of time with, I believe, over 1,200 ideas and recommendations from the public. It's very balanced. There's difficult decisions at every turn of these recommendations and of what we're considering, but I am also supportive, especially of the managed care provisions that are in the document. As a public hospital CEO, I just do need to say there's some elements of the indigent care pool which affect public hospitals in a unique way because of our funding mechanisms that I just hope can be mitigated. But again, thank you to the governor's office for their support of our work.
Thank you so much, Tom. I'm back on, Dennis.
Oh, good.
I got knocked off for a second.
Hi, this is Anna Klon. I just want to say also thank you to the committee and to the leadership and the staff that did the work. I also feel very comfortable with the whole proposal, that it was a very thoughtful process, and the commitment to continue the dialogue and understand the impact of the reform is very meaningful to me. I'm also grateful for the fact that we discussed behavioral health and developmental disabilities in that package, as that's my area of expertise. So I'm really grateful for the ability to participate and agree with the proposals we're putting forward.
Thank you so much, Donna. Anybody else? Okay, so what I'd like to do is take a roll call.
I'm sorry, Michael.
Yes?
Michael, I apologize. This is Steve Ballone, Suffolk County Executive. I just wanted to add in before we take the roll call.
Sure, thank you.
To join my colleagues who I thank for their work on the panel. I want to thank you and Dennis for your work during these very difficult times, particularly the staff, Paul, Donna, as well. I want to join my colleagues in thanking them. This really has been an incredible process, done in really warp speed and in the most difficult of environments. So my hat's off to everybody, and also on a subject that is of great importance to all of us in the state. So my thanks to everybody. I am supportive of the package. I will be voting yes for many different reasons, but because this is now more than ever critical to what we need to do in the state moving forward. I also want to just point out, because as county executive and as somebody in some ways representing counties, it's important that any of the items here that have an impact, and I think the ICP proposal is one of those that I would urge as the process moves forward to be looked at, because I would be concerned about anything that's really impacting counties who I think we can see through this process as hospitals, counties are on the front lines. And I think the governor, who has been doing an extraordinary job leading this response, I think he aptly described what we are going through right now as a wartime effort. And, the counties, as the hospitals are are on the front lines of that effort. So we know the impacts are going to be just devastating all around in our economy, in our society, the human services impacts. The counties who are chiefly responsible for public health and public safety will be devastated, no doubt. That is not for today. It's not for tomorrow. We are 100% focused on winning this battle and doing everything we have to do in providing the critical services we provide in health, in law enforcement and safety and all of those issues. But that is something that is going to have to be addressed down the line, as so many other things are. But having said all that, this is really tremendous work that has been done here, and I am supportive and look forward to voting yes.
Thank you, Steve. Thank you. Anybody
Michael,
else? Yes.
This is Dan. I think we're about to vote, and I just wanted to, first of all, thank everybody who participated in this process, and that we had these multiple conversations where we met with almost every single sector of the healthcare community in New York, from advocates to providers in all sectors, and they basically educated us about the ways, everybody with the same goal and the same interest, which was to make the healthcare system better so we could make sure that the Medicaid program was there for those who need it. And it was a wonderful experience, and I want to thank all of you, and you know who you are because we met with us. You met with Michael and myself, and I want to give a special thanks to Dennis Whalen, who basically was able to organize all of those conversations, and it was so important. The last thing that I take out of this is I remember my participation with many other people trying to pass the Affordable Care Act, and when we passed the Affordable Care Act, I literally said, my work is done. Healthcare is going to be fantastic going into the future. Little did I know that this is a lifetime enterprise. So what's my point? Here we are. We have, in 2011, we basically did a major push forward with the MRT1. And now in MRT2, we're starting to correct what went off the rails a little bit from MRT1. And it has to be an ongoing process. And I know that we don't agree on every single item, but it is, like we talked yesterday, it's direction and correct. And I want to thank everybody for participating in this process. And the last thing that I have to say, I'm so proud for our governor. He basically has been doing an amazing job in this most incredible crisis. In my lifetime, I cannot remember, I know for a fact, a period like this. And the governor is basically not only providing leadership from New Yorkers, but across the country. And in that sense, I'm very proud. So I feel very comfortable that whatever decision we are making, Paul and Donna and Rob and the governor are together with the legislatures, they basically are going to keep in mind that they're going to do the best thing for the people in New York. So I want to thank everybody for participating in this process. Thank you, Michael.
Thank you very much. Thanks, Dennis. Any other comment before we go to roll call? Okay, so let me go down the names. I'm asking for approval of the package. And so I'll mention your name, and then please say yea or nay. So let me start with Lorraine Brown.
Yay.
Steve Corwin.
Yay.
Tom Quattrochi. Sorry about that, Tom.
You got it, Michael. Yay.
Yeah. It's the Irish accent, Tom. It's the Irish accent.
Understood.
That was a yes?
Yay. Yes.
Maria Salento.
Yay.
Krista Vecchio.
Yay.
Pat Wong.
Yay. Yes.
Thank you. Emma DeVito.
Yay.
Wayne Norwood.
Yay.
Wade Norwood. Yes. Steve Ballone. TK Small.
As a matter of conscience, I have to abstain.
Okay. Donna Colonna.
Yes.
Todd Sherman.
Thank you, Chairman. In light of the future responsibilities of the legislature, I will be abstaining.
Understood. Blake Washington.
Abstain. Similar reasons as Mr. Sherman.
Yeah. Paul Francis.
Yes. Yay.
Howard Zucker. Ann Sullivan.
Yes.
Arlene Gonzalez Sanchez.
Yay.
Kate Kostner.
Yay.
Bob Magna.
Yes.
And Dennis Rivera. Yes. Mike Dowling, yes. I think I have got everybody. I haven't missed anybody, right?
I'm a yes, Michael. I skipped over, so Steve Ballone.
Steve, yeah. Okay, thank you, Steve. Okay, with that, we have 3 abstentions, TK Small, Todd, and Blake. And the package is approved. It will go to the governor. And I want to say a special thanks to all of you. Obviously, we'll all be talking about many parts of this as we go forward, not just only this year, but years to come. So with that, I want to say again thanks, and a special thanks to the staff, to Paul and Donna and all of the other staff, state staff that have been participating on this. This is yeoman's work in a very short period of time. And also, as Dennis said, I want to thank Dennis Rivera. I want to thank Mr. Dennis Whalen for his exceptional work here as well. So with that, I want to say thank you, and this concludes this meeting. Thank you very much, guys.
Thank you.
Okay?
Thank you.
Thank you.
Thank you all.
Thank you.
Thank you.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.